Okay. Hi, so I'm Sierra Colby.
And I'm Jolene Janicek, and we're here to talk about solution-focused group therapy.
All right. So origins of the theory. So it's also known as solution-focused brief therapy. And it started out of Milwaukee, Wisconsin. And the theory kind of started in like the late 60s, early 70s. And at the time, culturally, there was a lot of like rebellion and civil unrest. And a group of psychologists, mainly Steve DeShazer and Insoo Kim Berg, um, we're all kind of feeling like the way psychology was currently being practiced. The sessions were really long and a lot of deep dives into past and history, and so basically psychodynamic. And they were kind of feeling like it wasn't helping all the clients, and it was really expensive and time consuming. So they kind of met with a group of colleagues in secret for quite a bit of time, troubleshooting new approaches and techniques. So the Brief Family Therapy Center worked primarily with underrepresented individuals and families struggling with poverty, substance misuse, and other major challenges. So that was the therapy center that they eventually opened up. And they welcomed clients that were, quote, like difficult cases the other therapists were having trouble with. And they found with their approach that they were having a lot of success. And so this approach was strongly influenced by Milton Erickson, who believed in utilizing clients' unique set of strengths and viewed clients as stuck as opposed to sick, and avoided theories of personality disorders or diagnosis.
And alrighty, I'll jump in here. So, and thank you for that. More along the lines of like the values and or like what's called principles here that kind of underline this therapy is so I'll go down the list here. I don't want to try and read it line for line, but the relativism, meaning that the client's experience is what's important. You know, the client has strengths, and how it was kind of a switch, like what Sierra was talking about, these like more kind of pathologizing people instead of kind of meeting where they're at. And so, you know, in this aspect, making the client the expert who has their own personal resources rather than the professional who's the expert. The anti-essentialism. So that means we're not looking at this like long drawn out history and trying to like diagnose. Rather, we're more focused on the here and now. And so the anti-fundamentalism there, we're not trying to like establish the problem. We're more focused on establishing an emphasis on change and change oriented questions. And so like I think it kind of sums it up is like we're solution focused, right? So a lot of these things I've just talked about in these first three is like we're in the here and now. We're talking about, you know, uh, moving forward. And I think Siri is a good term, unstuck, you know. So it's like, how do we facilitate movement and not get stuck in the past there? Anti-universal. So this is like an emphasis on like multiple voices, stories, possibilities. It's really person-centered, system-oriented, you know, highlighting culturally situated subjects of lived experiences and someone's memory rather than more of a black and white diagnostic approach. Acknowledging the impact of language. So in this value, language is really, when I was doing the research on this, like the language piece is really important because it kind of is the main tool that we'll use to kind of shape, you know, going from a limited perspective and limited view to opening up possibilities with the person, identifying their own personal strengths. So that's like constructing a new reality, emphasis on constructionist rather than constructivist. So the philosophy is concerned with their outer world as well as their inner world, and agency versus determinism. So this is focusing on the person's own internal agency and really their voice and empower. It's more of like an empowerment model there. So, all righty, thank you.
All right, so some key concepts and basic tenets. So like Jolene was saying, the clients know best and are seen as experts on themselves and their lives, like person-centered Carl Rogers. And they encourage small changes, believing that one would lead to another. So sort of like tipping the first domino and encouraging a small healthy change that they could make towards their goal, and thinking that when they do that, it can gain confidence and then they can see benefits and it will just keep leading to more of that. And they believe that therapists are ethically obligated to help clients solve their problems as quickly as possible. So that's a big motivation in this theory, is using their time together very efficiently. And solution-focused brief therapy has been shown as an effective treatment for emotional behavior problems, substance abuse, anxiety, depression, crisis events, suicide, and self-harm. And two core principles. The first one, most clients' concerns begin as ordinary life difficulties and became problems after the client or others persistently applied the same ineffective solution attempts. And the second one, successful therapy interrupts repetitive problem patterns and encourages clients to do something different instead of more of the same. This kind of reminds me of the concept of like insanity, of trying the same thing over and over again, expecting different results. And so they view the therapist's role as, yeah, serving as an interruption and helping support them in identifying strengths that they have to make the changes that they need and supporting them in that way. And so in group counseling, conversations center around the client's concerns. So who and what is important to them right now, and in their future. And they explore a vision of a preferred future together in group. And they identify strengths and resources related to that vision. Therapists use specific responding and questioning techniques. So let's say someone says that they want to feel more connected with their children. And so a therapist might ask, what does that look like? Like if you were more connected with your children, how would you know that that's happening? What were some changes that you would see? And potentially some group members might have a shared vision in that and be like, oh, I would see that too, or this is how I would know. So they can really kind of feed off each other and support each other in a group setting. And so that kind of ties in with co-construction with other group members and facilitator in creating what, or identifying the vision that they really want for their lives and how to do that.
Okay, and now moving on to the theory tool belt. Some of those broader terms that we just discussed, kind of diving into the specific techniques and approaches. So we'll start off some of those like pointed questions and stuff. So the first one here, the crystal ball technique, that's where more a metaphorical question is posed, where the therapist would ask the client to imagine looking into a crystal ball and seeing, you know, what would it look like if your problem was solved, right? So if we're in the group and you know, we're in a part where we're one-on-one with someone while the group is listening, you know, asking them like, well, what would that look like, you know, to get, because again, in this making the client the expert, you know, historically it'd be like, oh, well, what, you know, the professional thinks like how the problem is solved. It's like the client has their own unique experience and they may have something completely different. And so that's why it's really important to stay in that solution here. So the goal development question also known as the miracle question. It was a key technique where the therapist will ask the client to imagine a scenario where the problem has been solved, and then to describe what would be different in their life that would indicate this change. And so that's kind of like establishing road markers for the client, right? Well, how would it look like if that change was about to happen? Well, now that you've uh, elicited a response and they've identified what that would look like for them, now they can be alert. And if they mention that in like a future session, then that could be like, oh wow, that's what we talked about in the past. So another technique, the pre-session change question. This question helps the therapist focus on positive shifts that have already been experienced before even entering the session, setting a positive tone for the therapy process and highlighting existing strengths. So this is like a strengths-based approach, and that's communicating with the client and seeing, things that they may have already started working on prior. All the work doesn't have to happen right there, with the therapist. Another important approach kind of is to stay future focused, and this was talked about in a previous slide too. And so that we're kind of staying away from putting a lot of energy into analyzing the past. And what we're doing is we're focusing the energy in the present, which is the right now, where that change can happen and where we can, have that empowerment. Pragmatism, if it works, do it more. If it doesn't, do something different, right? We don't need to completely understand why this, approach or, change or something is happening. This person has their own unique lived experience in life, and that spans, years and years. And there may be something that, is working for them. It's not important to kind of spend a lot of time analyzing that. If it's working for them, let's do it. If it's not, let's try something else. All right.
So some important terms and definitions, solution talk is used. And this is questions that are, or questions asked are almost always focused on the present or the future. So this reflects a basic tenet that problems are best solved by focusing on what is already working and how the client would like their life to be. And exceptions, specific moments or situations where a client's problem is not present or is significantly less severe than usual. And exploring what was different during these exceptions could lead to insight and potential solutions. So with exceptions, it's just digging a little deeper into specific situations where things went how they actually wanted them to go, and kind of looking at what happened there, what was different, can we learn from that? And using and instead of but language, the word and is preferred over but because it allows for a more inclusive and positive focus on both the problem and the exceptions, while the word but also tends to negate an experience. So yeah, the word but kind of just cuts out what was said before that. And with using and, it is just more expansive and allows to be able to hold multiple things at once. And compliments are also used. And so this is validating what the client is already doing well and acknowledging how difficult their problems are, encourages change while also helping them feel heard. Compliments emphasize the effort the client is putting towards change. And so in group therapy, the therapist can just stay really attuned to what the client's saying and just point out like, oh, that's different than last week, or I'm noticing that you are kind of making, bigger, small shifts towards your goals.
Okay, now onto the section on the multicultural piece and the diversity piece. A little bit of background information here. So I think we talked about in the first slide that solution-focused group therapy and solution-focused therapy kind of was at that pivot point where there was a lot of changes going on historically, where the whole world was taking a different lens on valuing culture and diversity. Some of the research that I did was talking about how, like, you know, at the end of the civil rights era and stuff, we were integrating a lot of the changes and here, but also worldwide. I think there was other, they talked about, like, in Europe, there was pieces over there which were linked to this theory. So it was like kind of like gave birth to like something new needed to happen that embraced and could like integrate what was going on in the world, you know, in that pivot there. But in this regard, the counselor and client work to define the situation so that it's better for the client. Because the counselor is focused on the client's language and understanding their situation, it's culturally sensitive, is like we're picking up on what they're telling us as the expert. And so however someone defines their culture and they show up, we're going to integrate that language in there. We're also considering the client's worldview and in their own language. This is a direct quote here, working with many diverse populations, Latino, Latina, Asian Americans, white Americans, African Americans. It's all been proven to have positive outcomes and remain culturally sensitive and applicable against many cultural beliefs, which is, I think, different. And I think we talked about this in the beginning as well, is like we were coming out of this like psychological analysis where it was like white men, right? And they like gave birth to a lot of this, you know, psychological, you know, foundings. And then there's a shift of like, wait a minute, like we're moving away from that top down kind of expert model there. And in fact, meeting the client where they're at. So go on to the next slide. I think there's another quote there, a couple of them. Solution focused group therapy reconnects the person to the resources that exist within their lives and not specifically only within themselves. So that in terms of a cultural lens, connecting individuals, you know, to resources that are culturally relevant and safe for them in their world. Oh, and I think this is what we were talking about, or I guess what I was talking about in the last slide. You know, the kind of revolution that happened with this at the time, Europe was witnessing coming to terms with like the post-colonial concerns of those previous generations. And so, which is really cool that, you know, this theory was kind of like on the forefront of that. So thank you.
Yeah, I think that that kind of concludes it. And then we just have our references there. So yeah, thank you.
Thank you so much.